Hi, welcome to another video as part of our clinical education series here at Industry Labs. My name is Dr. Michaud, our Director of Clinical Treatment, and our focus today is on our PCR reports, and specifically our UTI PCR reports. I just want to give a brief overview of what is on it and where you can find the information that you're looking for so that you can efficiently use these results that you're getting back from Industry Lab. At the very top, you'll see the name of the test that was ordered. So this was our UTI comprehensive test plus antibiotic resistance, or ABR. And then immediately we just show you what was in that sample. We waste no time getting to it. And in here you can see there were 3 organisms detected. This was an elderly patient sample, so polymicrobial results here. And we list these for you in the table in order of most prevalent to least prevalent, so that you can get an idea of relative quantities of these organisms, and obviously focusing on especially the top organism as often the primary pathogen in a UTI. Next to the results table with the organisms, we show the resistance markers. If these genes are not familiar to you, they're not familiar to most of us, we translate that over here as well to talk about what kind of resistance that causes. And then we take all of this information up here and synthesize it directly below into this antibiotic treatment tool, where you can see things in green, yellow, and red. Green means, and these O's mean, that that antibiotic will work for that bacteria or that organism. So if the antibiotic would cover everything found, in this case all 3 organisms, then you'll see all 3 circles here, and those will be shown in green. The antibiotics shown in yellow work for some, but not all organisms, which is still useful. Perhaps you look at this and say, oh, this patient is known to colonize this low-level Bacteroides. I don't think I need to target it with antibiotics. You can come down to this table and see that there are additional options that will cover the Pseudomonas and the E. coli, including phosphomycin here, perhaps. And then antibiotics shown in red are best avoided, either because they have no baseline coverage of these organisms. You can see fluconazole over here, an antifungal, obviously won't cover any of these 3 bacteria, so all 3 X's. Or you can see some things that do have baseline activity, but because of the resistance detected in this top row here, these are best avoided. So we put all of this information for you from here into this tool right here to help you quickly get to an antibiotic and figure out what treatment option might be best for your patient. And that's really it. All the main information right on page 1 for you. If you go down a little bit further onto the second page on this report, you can see all of the organisms that were tested for but not detected. In case you won't say, did they test for Candida or did they test for staph? You can find that information here. And then you'll also be able to see the full list of antibiotic resistance markers that were tested for as well, but were not detected in this sample. And finally, the last thing to highlight, I'll make it a little bigger here. Oop, not that big. Is our Report RX clinical consult service. This is a team that I help lead, where we can help to lay a second set of eyes on these reports for you if desired. We want to make sure as a clinical lab that our results are leading to positive patient outcomes. So if you ever have a patient-specific question about a report, or a clinical scenario that doesn't quite match the results, or a general PCR question at all, feel free to give us a call here anytime and we can talk that patient over with you. And with that said, thanks for watching, and we will see you in the next video.